All right, a surprising statistic for women. Heart disease is responsible for killing 35% of women every year, more than all forms of cancer combined. An upcoming event is providing women with education that could be life-saving. Here to discuss this is Dr. Stephanie Saucier, a cardiologist with Hartford Healthcare's Heart and Vascular Institute in Hartford and Southington. Welcome.
Thank you so much for having me today.
You bet. All right, what exactly is heart disease and what are some of the symptoms that a woman could experience? Sometimes they don't know.
Well, there's many different types of heart disease. However, the one that we think of most often and is most common is coronary atherosclerosis, which means that there's plaque buildup in the arteries of the heart that then can occur a heart attack. And that's really the most common type of heart disease that we talk about and when people are really worried about heart attacks. So symptoms that people and women can experience, including chest pain or chest discomfort, shortness of breath, fatigue, and even nausea sometimes. So it's really important to take a look at how you're feeling and what your symptoms are.
What are the risk factors?
There are some risk factors that we can't change, and then there's a lot of risk factors that are modifiable. We think that about 80% of heart disease is preventable. So some important risk factors include your family history, your cholesterol levels, if you're a smoker, high blood pressure, diabetes. Those are some of the most common risk factors. But for women, it's really important because our obstetric history is also a risk factor. So gestational diabetes and hypertension disorders of pregnancy are also risk factors for developing heart disease.
All right, so given genetics, that's in there, of course. How can we reduce the risk of heart disease?
So we really want to focus on, one, understanding what the risk that you have is, and then doing things to modify those modifiable risk factors, keeping your cholesterol under control, not smoking, keeping your blood pressure under control, exercising, sleeping well. There's a lot more, but those are kind of some of the big ones.
All right, and tell us about an event coming up.
So we're excited to be hosting the 10th annual Penile and Prevention event. This year, it's Thursday, September 12th from 5 to 8:30 p.m. It's at the AquaTurf in Southington. We'll have vendors, raffles. We're going to do an education session with Dr. Heather Swales and myself about heart disease in women. And then we also have a comedian. So it's a great night out. You can register online and, just learn about some heart health and have a good time.
I love the comedian part. Dr. Stephanie Saucier, thanks so much.
Thank you so much.